Recognizing and treating external sickling. Today we're going to walk through how to recognize and treat external sickling, a fast developing emergency that every coach, trainer, and responder should be prepared for. A few quick details can make the difference between a safe outcome and a life-threatening event. This is a quick guide and public announcement for coaches, trainers, and responders. External sickling happens when intense exercise causes red blood cells to deform into a sickle shape. When that happens, those cells can't move through blood vessels the way they should. They start to block blood flow and they can't create a rapid medical emergency. This only affects individuals who have a sickle cell trait, but because SCT is relatively common, every sports program needs to be aware of this risk. Why is this so dangerous? One of the biggest challenges is that external sickling can look like other, more common issues. It may resemble fatigue, dehydration, or early heat illness. Because of this, symptoms often get overlooked. But when an athlete begins to sickle, things can go downhill very quickly. Collapse can happen suddenly, and if the warning signs are missed or dismissed as just cramps, the consequences can be extremely fatal. Key warning signs. There are several red flags we may need to spot right away. Watch for sudden muscle weakness, especially in the legs. The athlete may slow down, stagger, or fall behind the group. Many will slump to the ground, but without the muscle locking you see in a cramp. They may complain of pain, breathlessness, or intense fatigue very early in the workout, often within the first few minutes. When you see these signs, stop the activity immediately. How it looks versus heat cramps. It's important to know the difference between external sickling and heat cramps. In external sickling, the muscles stay soft, not rigid. The athlete is usually alert and able to talk. The collapse tends to be quick but not dramatic. In contrast, heat cramps involve tight, painful, visible, contacted muscles, and they're often tied to high heat stress. Recognizing this difference helps ensure the right response. If you suspect external sickling, act right away. Stop all activity. Call EMS, especially if the athlete collapses or is in significant distress. Provide high flow oxygen at 15 liters per minute with a non-rebreather mask. Check airway, breathing, and circulation and keep the athlete calm and cool. Monitor vitals continuously and make sure the responders know the athlete has sickle cell traits. Every second counts. What not to do? There are a few things we must avoid. Don't assume the athlete is tired. Don't push them to finish the drill. Don't stretch or massage the muscles. They're not cramping. And most importantly, don't delay oxygen or EMS. Prevention starts with smart training and communication. Modify conditioning for athletes with sickle cell traits. Avoid repeated all-out sprints or high-intensity time drills. Allow athletes to self-pace and stop the moment symptoms begin. Build intensity gradually and make sure all staff members are aware of the athlete's SCT status while respecting confidentiality. These small adjustments significantly reduce risk. Key takeaway: this formula is simple. Early recognition plus immediate oxygen saves lives. External sickling can turn fatal within minutes, but with awareness and fast action, it's fully preventable emergency. Thank you for your attention. Protecting athletes starts with knowing what to look for, responding without hesitation. Recognize, respond, and prevent. And together we can keep every athlete safe. These are my resources.